I'm Michelle Selinsky, and I'm the marketing director, and I wear another hat. I also represent the company as a patient advocate. And you might be saying, well, what's SKR? Well, we are a private duty home health care company that has a specialty in providing registered nursing care, and you name it. Our nurses act as patient advocates. So with that, I thought I'd just tell you a little snippet of my background. I've lived here in Sarasota for 22 years. Had a background of pharmaceutical sales for a time in New Jersey, then segued into health and fitness, and became a patient advocate here in Sarasota County privately about 17 years ago for a family that I had been representing and working with for a number of years. So a little personal note, my husband was diagnosed 22 years ago with a very rare neurological progressing condition. And I know I'm here as a role as a professional advocate, but I'm also someone who can empathize with family members and caregivers and friends because I was one. I was a wife, had my husband hospitalized, and dealt with the madness that it can be, the complexities of navigating his journey with his health. So let's talk for a minute about really what is patient advocacy. It can be a trusted professional like myself or geriatric care manager, a nurse. It also can be a support person that you already may have in your life, whether it's a spouse, a loved one, a friend. So it doesn't have to be someone that you hire that could represent you as a patient advocate, but as long as the person is there to help navigate the complexity of the healthcare system that we have today, patient advocacy ensures needs and concerns are heard. They support access to proper treatments and different therapies, and hopefully promotes dignity and the quality of life.
You're not showing us the look.
Here's something. Okay. So what actually is patient advocacy? Look at it as a bridge.
Are you hearing?
So it can be a bridge between the patients, families, and in the case of a condition like Parkinson's or somebody else who may have a chronic heart disease, there could be an awful lot of healthcare providers involved in that person's life. So creating a bridge ensures voices are heard in all medical decisions that are made on behalf of a patient, including protecting the rights and the dignity and the quality of care for its patients. So any questions so far? Pretty simple?
The shock, I think.
I'm hearing. Might be Zoom. Okay. We're going to go through this quickly, but I just wanted you to have a little bit of a sense of, if you've never heard of a professional patient advocate before, I wanted you to have, there's 10 reasons. And the first is, expert guidance. Well, if you're paying somebody, you want them to be a professional and you want them to have expertise, right? Well, patient advocates, professional ones, should be well versed in the intricacies of the healthcare system, and at times be able to guide you through some pretty complex decisions, okay, and help you make and understand what your options are. And sometimes that's just it. People don't know what their options are, and having an expert can help you find out what those options are so that you get the best possible care. Personalized support. Every single one of us on this planet has unique needs, and people with Parkinson's, each particular person with Parkinson's or any chronic illness has unique needs, different symptoms. So having a patient advocate can help personalize that support system for you. Effective communication. Well, I don't know if any of you ever have experienced navigating, whether it's through the hospital or physician's offices, and you may find out if you have multiple healthcare providers involved in your life or your loved ones, you may find that they're not always communicating real well together, right? I don't know if any of you
Don't leave me.
agree. I get a few heads shaking, yes. Well, a patient advocate is there to help streamline that communication, to ensure that the messages are conveyed and understood by every single party that's involved in your healthcare journey, okay?
Tell.
Well, advocacy and empowerment, the idea is to fight for your rights and ensure that you receive the best care, right? Well, I'll tell you, fighting for your rights can be a little challenge sometimes if you're on one side of the hospital bed and you're kind of coming out of it. You might have had a procedure done and you might not be thinking as clearly. So having a professional patient advocate, even if that person's hired just for that snippet of time, maybe for your procedure, to help you. I know my husband needed me. I ran home after he had a heart procedure. He was recovering, and make a long story short, I got back up to the floor after being gone for 45 minutes, and I noticed something was going on with his neurological condition. And he could not speak for himself because of the twilight. This propofol was affecting him, and his neurological condition was worsening, and it wasn't being picked up on. So I became his voice. And also probably saved the hospital from having a medical error, which brings us to number 5. It is the leading cause of patient harm. It can be just by making sure there's accurate information, that, again, communication, right, between healthcare providers, and making sure that there's appropriate care. It's another key factor. Another one is coordination of care. When you have multiple healthcare providers in your lives, you may have multiple appointments. You might actually get multiple treatment plans. So hiring a professional patient advocate can kind of put it all together, so it may not be as overwhelming having someone guide you and making sure that things are very seamless, so communication doesn't fall in any gaps. Access to resources. Well, you all have this beautiful place, thankfully, right? Well, a lot of people don't have that. So having a patient advocate, they don't have the Parkinson's place in many communities across the country. So having a patient advocate to help navigate, to figure out where resources might be within your communities could be truly beneficial, and also navigate insurance coverage and help find out if there's any financial assistance programs. Financial assistance programs do exist. A lot of the pharmaceutical companies do offer programs, though they don't advertise it. I had a gentleman who did not opt into prescription insurance and ran into a pickle when he was prescribed a heart medication that cost an awful lot of money. So I was able to do a little digging, and we found a program that the pharmaceutical company had in place, and he got a very good discount on what would have been I think it was $600 or something like that a month. So we got it down to, I think, $70-something. So part of my job. Emotional support. Well, it can be very challenging to be diagnosed with a chronic illness such as Parkinson's. So having somebody, another set of ears, another set of eyes in medical appointments can help, just also with empathy, and help guide a person who might have a diagnosis such as Parkinson's. Cost savings. I had a client who had anemic. He needed an iron infusion. So his doctor, not knowing, he wrote a prescription for an iron product to have an infusion at one of the local hospitals. Well, he didn't realize, this doctor, that the drug was, that iron was no longer on formulary. It was still in existence. I called the insurance company just to verify, found out it wasn't covered. $8,700 for this product. So my job was to say, okay, well, does the hospital have iron that would be just as efficacious? And with the same safety profile as the one that the physician had written for? And the answer was yes. So I called the physician's office back, asked if he'd mind writing the prescription for the medication that would have cost $100 out of my client's pocket. And I will tell you, thought that was done. Well, the day of his infusion, here comes the nurse with the bag of iron. And I said, okay, just so we're all clear, I want to make sure you have that was the name of the second drug. They had the first drug. So something either was human error, that it wasn't removed when the second prescription came in for the drug that was on formulary, or it was something in the system. So you should have heard the buzzing that occurred that day. So yeah, it would have caused a headache because we would have had to figure out, but I had documentation, so we wouldn't have had to pay that $8,700, but it would have been a headache. So I probably gave him peace of mind. And I think I gave the charge nurse as well as the other nurses who were buzzing around somewhat freaking out, and when I told them to relax, because I did not want my client upset, because we were going to handle it. And whatever I needed to do as his advocate, as his voice, he happens to be a gentleman who has cerebral palsy and a very severe speech impediment and gets very anxious, always thinks he does something wrong, and I wanted the nurses to cut it out and calm down. I said it very nicely, and I said, please, it's going to upset him. We'll figure it out. I didn't make a big deal out of it. I knew we would. And 2 hours later, he got the correct iron. Now, in that case, he didn't get injured, but he wouldn't have been injured, but it would have cost money, okay? So this is just a summary of what I just said. So I don't have to read it to you all, but it's in your packets. So why advocacy is essential for chronic illnesses such as Parkinson's, you might be asking? Well, there can be complex care needs as chronic disease states progress, like Parkinson's. You may have already experienced this, some of you. You may have already experienced some miscommunication among providers. That's common. It's actually common across the board. Limited access to therapies. And a lot of times people just don't know what to ask for. As simple as that. So there could be therapies in the community that are out there that could be beneficial, and having an advocate might be able to also help with access to therapies. But here's another one, the stigma in public settings. Advocates can help educate the public on different disease states. And when you have something that is a progressing disease state that does show symptoms on the outside, such as tremors, it can also potentially create some invisible symptoms, like maybe anxiety, some depression, and maybe fatigue. So having an advocate in situations to just help build and boost confidence and be out in communities like this can help educate and create more awareness of what to look out for and with symptoms, and to just teach people how to have more empathy and pay attention, get their heads out of their phones, right? See their surroundings. So, unique needs of Parkinson's patients. Well, again, as it progresses, there might be complex medication regimens. We talked about access to therapies. There could be misdiagnoses. I know with my husband, he was misdiagnosed until recently. And when you have misdiagnoses, you can have prescriptions written that might not be the best for you because you got misdiagnosed. So we talked a minute about invisible symptoms and combating stigma in public and social settings. So I'd like to give you a couple real-life examples, and one is about medication timing. The other will be about helping push for referrals following provider directives when you may have multiple physicians involved in your healthcare journey, as well as appointment support and preparation. So the first example that I have here is for Mr. J, who is 68. He has mid-stage Parkinson's, and he's experiencing some off periods in the afternoon. Well, his wife noticed the symptoms had worsened when he took the medication late. So having a patient advocate involved, when the wife mentioned it, well, the patient advocate said, well, that's okay. I think we need to get on the phone with the neurologist and maybe adjust that schedule. And that's exactly what happened. They found a better time for him to take that medication regularly, and he had improved mobility as a result and created less stress for his wife. Here we have Mrs. L, who is 72. She's struggling with speech changes and swallowing difficulties. Well, her provider hadn't referred her to a speech therapist, and maybe the family, loved ones, didn't realize, and they just thought, okay, this is just the nature of whether it was dementia or Parkinson's, happens to dementia patients as well. So a private duty nurse advocate got involved and said, hey, I think we might be able to do something. Let's push for a referral for a speech therapist. And that's what they did in this outcome. She began therapy. Her swallowing improved, which created better safety for her. And she regained confidence in conversations again. Okay, just because somebody said, hey, there could be a therapy for that. Listening to directive, I touched upon this a little while ago, but goodness, is this common across the board. Here's Mr. D, he's 75. He's had multiple specialists in his life, neurologist, cardiologist, PCP stands for primary care provider. So the family started feeling overwhelmed. Why? Because you have different instructions being given by different people. Patient advocate organized a shared care plan and reviewed all the directives, created a better team communication situation for the family and Mr. D, as well as reduced duplicate medications and fewer ER visits. I will tell you, this reduced duplication medications, if anybody has ever been hospitalized and then may have had a period of time to go into a skilled rehabilitation situation, a lot of times medications are not on the ones that you take at home. They're not necessarily the same ones that you're going to be given in the hospital. They might be the same class of medication. They might be the generic. There might be other things going on, that maybe their medication changes. So when a person comes home from the hospital or from a rehab, our nurses, and I've seen it done recently, a very complicated case, it's called medication reconciliation. So when our care plan is put together and someone comes home, they're brought home by one of us, and just to make sure there aren't duplicate medications, because it can happen, it has happened, people don't realize it, and then they end up in the ER. So here's a situation that maybe some of you could relate to or might know someone. Somebody was caring for her husband with advanced Parkinson's at home. Started burning out. You know, the adage of having to put the oxygen mask on yourself before you can help anybody else, right? You got to keep it on yourself. Well, there is such a thing as caregiver burnout, and it sounds like Mrs. S was heading that way. She started missing her own appointments and started feeling isolated. So by having and hiring a private duty nurse for a respite situation, that nurse helped care for her husband for a period of time, provided some education, and emotional support that Mrs. S truly needed. And she was able to gain balance again and knew that her husband was receiving excellent care while the private duty nurse was there. So it can be just for a period of time. Well, some of you might have or know someone that may have experienced this, physical tremors and anxiety in social settings, and how to combat that, right? I touched upon that. As I mentioned, I had a client who had the speech impediment because he has cerebral palsy. And people, for some reason, every age group, when they heard him speak, would speak back to him in this elevated pitched voice. It's the strangest thing, human nature. So I used to write on every single intake form and notes, my client has superb hearing. He has sonar hearing like a bat. You don't need to raise your voice just because he happens to have cerebral palsy. So, I mean, that was one way of educating with an exclamation point, right? And at certain offices, they just kept doing it, and I would write it every single time, And other times, I've worked with people with dementia, and sometimes people don't know how to interact, and they'll look at me, and my clients here. So just by re-engaging, and you can do this very graciously so that there is eye contact made and the questions do go to that person, because again, a patient advocate is there to protect rights and help combat these stigmas and help educate communities. And if I could educate in that capacity in healthcare and physicians' offices and hospitals, I've tried to do that. And then again, I joke around a little bit because it is irritating. But you don't get anywhere with vinegar. I have to use honey. So anyway. So preparing for appointments. If you take one nugget, take this one. It's in your slide. You can throw the rest out. But this is so important. Whether you keep two, meaning you have it in your phone, a picture of it in your phone, and then you know where to find it in your phone if you have lots of photos, or just put it on a piece of paper, condense it, fold it, and put it in your wallet, but keep it updated. Track symptoms with a daily journal. And I will say, tracking symptoms in a daily journal, that could be on a computer also, but this way, physicians don't typically take a lot of time with patients, right? They get a snapshot view of one's life. So the clearer you are, if you're an advocate for a patient or you are the patient, the clearer you are with what symptoms, what changes are going on, the better, the more time they'll take with you and respect you for the fact that you have all this information and you want answers, okay? Because you deserve answers and you deserve their time. So write down questions in advance. Bring someone with you. Could be a friend, a loved one. Bring a notepad. Take notes. Bring those questions, write the answers there, and share any concerns. Again, we talked about, particularly with Parkinson's, you may have some invisible symptoms. Again, if it's not brought up, the physician may not be able to read your mind and be able to see. And if it is a concern, then there might be some therapies and such that could help you. There's Lauren. That's our clinical director. She's an RN. And she does all of this stuff. As I mentioned already, medication reconciliation is really, really important. Creating personalized care plans with patients and caregivers. She accompanies patients to doctor's appointments. We'll ask those questions that they come up with together. And she does support and educate when there are caregiving teams as well. So I've learned a lot from her. And I'm also somebody who does some of this, but I don't get involved in the medications. That would be Lauren, and the rest of our nursing team. So we touched a little bit about this, but promoting the understanding of motor and non-motor symptoms in the communities around us, family members, encouraging empathy and inclusion in all social spaces. So, Sarasota is such an inclusive community. We do have lots of different non-for-profits and resources, but there are so many communities that don't have what we have here, that it is really important to, just spread the word in any capacity that you can to help create awareness of symptoms so that people feel more included out and about, whether it's in social settings, just small groups, or if it's out and about. Creating some outreach can help combat the stigmas that are out there. Well, the impact of advocacy, hopefully, is to have better health outcomes, reduced hospital readmissions, increase patient independence, hopefully, and provide peace of mind for patients and their families. Well, in closing, I'd like you to think about patient advocacy as more than just support. It's, as a whole, it should be a voice for patients' better care. We want to encourage families to become patient advocates, to learn a little bit more. Again, in a place like Parkinson's Place, there are so many classes where people can learn what to look out for, how to become better advocates. And if I can help in any way, having this opportunity, I'd be happy to and open to talking with Sally and how I can help and SKR can help, as well as just creating a stronger community for Parkinson care overall, right? So this is just a little snippet of what my company does, which is a lot. We're kind of a concierge boutique style, again, with skilled nursing. And it's on the back, the phone numbers are there, but I just wanted to give you a sense of, yes, we are advocates overall, but we can help in all sorts of facets. And I just want to thank you all for being here, and both phone numbers are there, mine as well as the owner. So thank you so much. Does anybody have any questions for me? Anything that comes to mind? Hi.
Normally, what's the term, legal term of advocacy? Is it as needed or?
Yeah, that's a great question. So what could be the length of time? Well, particularly for, well, look at it this way. Every single person's different, right? So we create care plans for whatever the needs are for patients. So I don't really have a price sheet or anything, because it really depends upon what someone is looking for in terms of their care. If it's maybe an assessment to see where you are, an evaluation, it could be just coming up with a care plan, and maybe somebody stopping in once a month and just making sure medications are being taken and there's no issues that could come up. But it would depend upon what your wants are and the needs are, and that sit down with the nurse and chat a little bit. I would say probably that might be helpful, just to get sort of an assessment done. That's what I'd say to start with, to see. Yeah, so it could be a couple. You could hire us or someone else just to take you to doctor's appointments, write notes, communicate with your family, and that's as often as you see the person. Could be that. In our company, we act as advocates, transporting clients to elective surgeries, and then taking them home and reconciling medication too. So, and then providing some care if needed or not. So it just completely depends upon whatever the needs are and your desires, and come up with that plan. Okay. Anybody else have any questions for me? Yes, yeah. So it's a great question. So the question was, is there an hourly charge? And yes. So in the case of taking somebody to doctor's appointments, an assessment should be done just to get a sense of what's going on. But if it's, well, I shouldn't say that. Usually that's the case if we do assessments and evaluations. But if you are somebody who kind of feels and you just want to have someone there with you to take you to the doctor's appointment, then it would be an hourly fee. But I would say, there's probably a meeting beforehand. So maybe a care plan could be in place or talked about as well. So it could be, 2 hours or something like that for, chatting a little bit beforehand to make sure you have all the questions down and then to the actual physician's appointment. So, yeah. Yes, yeah. More than likely a registered nurse. When we talk about chronic conditions, and I get involved as well as a patient advocate, but quite frankly, it depends upon how clinical because I'm not a nurse. So I've represented some chronic cases as a patient advocate, and I will tell you though, we did hire a private duty nurse that I could check in with. So I was kind of very involved in this family's lives. They trusted me wholeheartedly, but as there were some issues that were creeping up, I wasn't as comfortable, though the family wanted me to continue to be that person. So I was able to at least open a chain of communication with a private duty nurse. And she kind of, if I needed her, reach out. So that worked out great in that scenario. So in this scenario, it could be me where I'm communicating, taking someone to the doctor's office, and then Lauren is also involved, our clinical director, because we would want to make sure that we'd have that streamlined. And so I go to a level, but then, it kind of depends. So does that answer your question? Okay, yeah. Anyone else? No? Okay. You're so welcome. Well, thank you. Thank you for being here. I appreciate your time. I hope that, like I started with, if you got a golden nugget or two, I hope that if you did, fantastic. If there's anything that comes up in the future, my number's on that back page. I have cards as well. I'm happy to provide my business card to you all. And I'd be more than happy to sit down with you and chat with you a little bit more if any of you wanted to give me a call in the future to learn a little bit more about how we might be able to help you out. I would greatly appreciate it. But yes, hi. We don't, though we have partnerships. So if you're looking for someone in Hillsborough, I can put my feelers out and line you up with a similar thinking company for sure. Okay? Be my pleasure. We're private duty, so the answer is no. However, if there are instances where maybe your insurance has, and you have the need for some care, whether it's maybe skilled nursing from an agency that would come in through Medicare, let's say for wounds, antibiotics, things like that, speech therapy, we can work side by side at times just to help fill in the gaps at times, because people with insurance, if you have to fit, Medicare has this criteria that you have to meet to be able to have someone come to the house that are, that it's covered. Yeah. And if you meet that, I say, great, use that insurance. But if you need a little bit of extra, that's where we can help work alongside. And I know some very good companies, having been a health advocate, I've worked with a number of companies. So I want to say, maybe in closing, I have been here for 22 years in different capacities, but all in health related. So if any of you have any questions, it might not be you're looking for a private duty nurse, but think of me as a resource. Feel free to reach out to me if you want to know of a skilled nursing company that provides a different therapies. You know, someone's coming home and you want to get just one more thought, of someone who's worked with them. Feel free to call me. Okay. I'd be happy to. I have a list. I should say I have two. I have the good list and the Yeah, not everybody provides the services that they say they provide. So there's a shortage. Leave it at that. But you wouldn't necessarily know that if you're somebody who needs it. So anyway, I thank you so much for your time. And again, if I can be assistance in the future, I'd be more than happy to answer any questions.